Behavioral Health Services Nursing Administrator Courtney McIntosh and nurse practitioner Jessica Hall. Welcome to the show.
Thank you.
Thank you.
Yeah, great to have you here. Behavioral health, that's an area that I think is very appropriate to talk about today, being World Suicide Prevention Day. And for many years, it was something people just did not talk about. The media, they would never report suicides, but we can talk about it.
Yeah.
What should we do if we suspect a loved one might be in danger of harming themselves?
Yeah. So first, thank you for having us on and giving us an opportunity to shed some light on this. Recognizing that suicide impacts a lot of people, and it is something that historically people just don't even like to say the word. There's a lot of stigma around suicide and mental health in general, and it's scary, it's uncomfortable. But what we know now is that saying it out loud, bringing it into the light is important. It's an important part of the conversation. And so if you have a loved one who's struggling, the first step is to have those conversations, ask the tough questions. Ask specifically, are you having thoughts of suicide? And then listening without judgment, and not minimizing someone's feelings or emotions.
Well, that's got to be a tough conversation to have, especially if that person is considering harming themselves. The signs, people will say, oh, I had no idea. I didn't see it coming. Are there some signs that we can watch out for?
Yeah, and I think the big thing is any change in someone's baseline, behaviors, moods. So maybe somebody who's typically pretty content and happy-go-lucky, and they've become more isolative or withdrawn. Maybe they're not responding to text messages. There's been a change in level of functioning, so that could be like parents not attending their kids' sporting events, or someone at work that's struggling to keep up on normal tasks. Shifting to things like aggression or agitation. We recognize increased risk-taking behaviors, so that could look like substance use, maybe participating in things that do have some risk and doing that carelessly. Those are some big things to kind of watch for.
Yeah, like drinking and driving, or
not using your seatbelt.
Yeah, wow. If you suspect, so something's off, you don't know what, but it could be. Then what do you do? Who do you call? Who should someone call if you suspect this is, going to go somewhere?
Mm-hmm. So there are a lot of options for families, friends, and individuals. Particularly, they could contact the 988 National Suicide Crisis Line, which is relatively newer and has truly saved lives. Additionally, they can contact local law enforcement. They can use law enforcement presence as well as Lifeway's Crisis Center. They have a 24-hour crisis residential unit and a 23-hour observation unit, as well as our Access Center. We're very fortunate at Henry Ford Jackson to be able to have top-of-the-line master level and bachelor level clinicians that provide crisis intervention, psychosocial evaluations, and then can help family and friends kind of navigate the behavioral health world and what comes next, whether that's inpatient care, outpatient care.
Yeah, it's changed a lot. So people, think about back an earlier generation. Someone might say, "We are going to have this person committed to a mental hospital." Mm-hmm. That's not something that happens anymore.
So we try to take family and friends' input into consideration. Michigan does follow petition and certification process, and specifically at Henry Ford Jackson, we do allow a patient to sign involuntarily, which would be a family member writing out a petition warranting the concerning behaviors. And then we also allow voluntary, so the patient is actively seeking help, wants to have involuntary admission to inpatient. But really, inpatient isn't always the answer. You can do a lot of work collaboratively with family and friends, creating a safety plan, following up outpatient. We do have a partial hospitalization program as well. So there are different levels of care. We try to stay away from the words committed. It's scary for people, and we don't want that to be their feeling.
Yeah, I know people that have attempted more than once, and I think that's a big fear. You think you've solved their issue, and you haven't. Are there things that you can do in behavioral health that can someone be cured of that desire?
I think it's important to recognize that with a lot of mental health conditions that there's a spectrum, and so there are folks who have chronic suicidal ideations, something that they've struggled with for a majority of their lives but never have an attempt, and there are people who will have an attempt who never had thoughts prior to, and so I don't think we look at it like a cure. I think we look at it as healing, as growing, finding ways that they can leave space for the struggles, but also thrive in other areas of their lives, and really just support that. And we do that through connection, I think, is the big thing.
Yeah, and I'm glad we're talking about it today, because I'm sure people have no idea that these services are available. And there's some common misconceptions about suicide as well. I can think of one that I've heard. Well, if someone tried and didn't actually kill themselves, they aren't really trying to kill themselves. Is that a misconception?
Yeah, I think it's a big misconception, right? I think there's different lethalities to things, and sometimes we see that as maybe a cry for help for some people, certainly, and that becomes a risk factor for suicide in the future. So we take those things very seriously. Some people, if they've had a failed attempt, that can really be an eye-opening and awakening experience for them, and we encourage people to share those lived experiences. Those make a difference for other people who are struggling.
People will write a note. Is that, is that common, or can people take their own life without leaving notes, or just no clues, no?
I think it varies. I mean, I just think that's varies, and one of the stigmas, I think, or the misconceptions that we hear a lot of times with suicide is that it's selfish. And that's something that we try to educate people on, right? That when somebody is suffering so deeply with emotional pain and they get to the point of despair, their ability to think reasonably is distorted. And so most of the time they're not thinking about how this might impact their family or their friends or their community. And other times, right, one of the risks for suicide is feeling like you're a burden to your family members. And so in that way, they may wrongfully think that they're helping somebody out by taking their own life, removing that burden. So it's certainly not a selfish act.
So they're leaving behind people, and that's got to be one of the toughest things. What kinds of services and support do you have for loved ones of someone who died of suicide?
So I think there are like local, certainly the behavioral health services program, we see a lot of family members or just loved ones struggling with grief. NAMI is a national organization. It's the National Alliance for Mental Health. They have a website, there's local chapters. They have a lot of resources and texts and lots of different things locally. Jackson Suicide Coalition, that's a organization that partners with Henry Ford, Lifeways, and some other communities services. And they're actually having a Stomp Out Suicide walk, an event on September the 20th, 2 to 5 at Cascades. It's a wonderful event. It's a lot of resources for family and then people struggling as well.
And that's a new location for this event.
Yeah. Yeah.
All right, so what do you wish people knew more about behavioral health services at Henry Ford?
Sure. I think people like to mystify it, and some of that is a misunderstanding. They may not understand, physical health is directly related to mental health and mental well-being, and that it can impact anybody. I think anybody in this room may know somebody that has a behavioral condition or a psychiatric need, and that's not anything to be ashamed of. It's okay to ask for help. It should not be considered a sign of weakness. We are here, we're professionals that want to positively impact our community and provide resources for that healing. I think about children in our coaching world, finding that trusted adult and being supportive. Sometimes all it takes is just sitting in silence and holding a hand and telling them it's going to be okay.
Yeah, well, I'm glad that you guys are here today, and it's really neat that the two of you are in schools as coaches. We have Courtney, you're a JV coach.
Correct.
At Hanover.
Yes.
For girls basketball. And Jessica, you're a 7th grade girls basketball coach. Having an adult that knows, that's got to be such a great value to the kids in your world.
Yeah, so we have children, so being that trusted adult, providing that support, just being a third-party listener to the struggles that they face. When we were in school, it looks a lot different than what today's world is with social media and that kind of instant gratification of things. So being able to help them navigate a lot of the life lessons really translate into today's world, and I think we have a unique perspective to positively change and impact the youth in our community.
Yeah, the online bullying, the sextortion, these are just unbelievable things that are happening.
Yes.
And where are you guys located?
So we both coach at Hanover High School, and then our offices here in a Henry Ford capacity are downtown in the main hospital.
At the East Ave
Correct.
location,
Yep.
main campus.
Yes.
Main campus.
Awesome. Great to see you both. Thank you.
Yeah,
Thank you very
thank
much.
you.
With Behavioral Health Services at Henry Ford Jackson, Nursing Administrator Courtney McIntosh, Nurse Practitioner Jessica Hall, our guests today on Wellness Wednesday, presented by Henry Ford Health. We have a pet of the week that